I told you guys I would be working on the delivery of the podcast. That meant a better camera with better quality and a mic that looks like a uncircumcised penis right in front of my face. And I swear, if anyone who tells me this does not look like a penis, you are fucking lying and you're dead to me. I feel like these mics were never even popular until Joe Rogan made them popular. So thank you, Mr. Rogan. Switching over to our topic of discussion today, we'll be talking about substance abuse and mental health in America. This topic is personal and very important to me because I've lost a close family member of mine due to substance abuse. This family member of mine was pretty young. He overdosed on cocaine and asphyxiated in his sleep while sleeping next to his younger brother. And I'm sorry, I should have said viewers' discretion advised. And as we go through this conversation, the statistics on substance abuse in America are mind-blowingly sad. But you know what? There's hope. There's hope because we have people like Julian who have dedicated their career to this. And let me tell you a little bit about Julian. Julian is a Partners in Prevention educator. For people who don't know what Partners in Prevention is, ChatGPT that bitch. I'm kidding. I didn't know what Partners in Prevention was myself. I had to ChatGPT it. They are a organization that prevent people from substance abuse and teach mental health advocacy through different programs. Julian also has taught ESL, English as a second language, in China and Tijuana, Mexico. So I'm very excited to have Julian come on as a guest and ask him all these questions. That being said, let's dive right in. Julian, you're a substance abuse and mental health educator. Some people might be wondering, is this guy teaching kids how to do drugs properly? So in your own words, can you describe what is a mental health and substance abuse educator?
That's such a good question. And it really gives me an opportunity to unravel some of the misgivings about our field. So, not once do we go into public school classrooms and pull out paraphernalia and say, this is how you use safely. When the minute we go in there to the minute we leave, we are saying we want to arm you with critical thinking skills and the ability to make responsible choices. And you're responsible. And guess what? If you screw up, it's not like other programs that shall be remain nameless in the past, four-letter acronyms. You can guess what I'm talking about. But we do not say that if you make a mistake, it's all over. In fact, we say that we educate the youth about how to understand the law and how to make the best choices and how to protect each other and really how to be able to understand what it takes to not only save your own life, but advocate for the well-being of everyone who's dear to you and in the community. So really, by going through the mental health components and teaching kids how to self-advocate from a young age and make sound decisions, the reality is, and also to encourage or foster an environment where kids feel more comfortable talking to their parents, like, what's going to happen? I better just be quiet about what I'm doing because I'm going to get in trouble. We cut through all of those relics of the past, because really the most extraordinary thing that you can do in my field is be able to know somehow, either directly or indirectly, you arm people with the tools to either save their lives or save someone else's life. And it's just, at the end of the day, that's the most important thing. That's the imperative.
Julian, how did you get into this field?
Well, I've always had a cursory interest in just understanding and um, being able to reconcile the rates of substance misuse in the country with some of the laws that tend to be relics from the Just Say No program of the 80s and Nancy Reagan, and just growing up with friends that were very permissive around drug use, and actually losing a few friends to substance misuse. It just it was something that I've always struggled to understand and wanted to find out a humanitarian answer to how to view this clinically as a problem we all have to deal with in a society, and how to understand the disease and how best to treat it in society, and how best to fix a lot of the problems that, I mean, the roots stem from all sorts of other places, be it fentanyl coming in from overseas, or the costs of illicit drugs, and what's put into them because of the illegalization, whatever people are going to do to try to make money in terms of dealing these drugs. It's so important to understand them from a supply point of view, because if you cut off the need from supply at an early age, which is what we try to do with Partners in Prevention, that is the only way that you can solve the problem in the future. And instead of coming up with a completely punitive mechanism, there are lots of diseases in the world with very annoying symptoms, like Alzheimer's or dementia. Nobody wants to deal with those hands-on. In fact, people might be abused by a relative who undergoes who's in the throngs of late-stage dementia or Alzheimer's. But we would never think as a society, oh man, what a drain these older people are having on us. They're just acting out. They're just acting out impulses of this old age behavior, and we need to lock them up to protect ourselves. Now, of course, I understand that addiction is usually hitting at another age or another time in people's lives, but the fact that we are so used to viewing it as a bad choice that people make, and then just trying to distance ourselves and say we need to lock these people up because they have a disease, just seems like the worst way of going about solving a problem. And it's borne out by how awful our problem with drug abuse in society, or I should say drug misuse in our society, has been. And the amount of overdose deaths, it's just so alarming, and it's something that we are clearly not doing right. But again, because it gets at the core of what brings a family together, and it's associated with behaviors that are very irrational, sometimes violent and dangerous, as people are willing to steal or do anything they can to get a hold of an illicit substance. We tend to view it primarily as a moral issue. And I'm not saying it isn't a moral issue at all, because it's very hard to deal with friends or family who make choices in the throngs of addiction. But we should view it clinically first and morally second. And we just put the cart before the horse and get it ass backwards.
What a great point, Julian. Uh,
Thank
Julian, what are some of the challenges you face working with kids in these situations?
you. I would say every once in a while there can be kids that might not understand the gravity of what we're trying to do or might make light of the situation. And then there might be pushback from the teachers, like oftentimes, or from the community. We don't feel comfortable with you talking to younger people about mental health or illicit drugs. And by and large, we do not. That's another misnomer. I don't know if it's coming from Moms of Liberty or what, but just the idea that we want to do how to use drugs and sexual health workshops for second and third graders, never mind the fact that it wouldn't work even if we tried. We just end up confusing a bunch of kids. That is not what's going on at all. So I think the challenge is when schools have a lot of parents who get a hold of misinformation, are kind of paranoid about the work they do, and instead of asking questions, make assumptions. And the more transparent that we show what we're doing is because we love our communities, we love our school systems, especially in Hudson County, which pushes such a high value on education and, dare I say, progressive values that bring the community together. I do not think that. I think that when you really want people who don't care as much, when you have parents or families or school administrators who are not as interested is in evidence-based approaches and what the numbers say, even if it disagrees with their point politically, that can be very frustrating. And then just like any educator, teaching middle schoolers is not an easy endeavor. It's a very difficult age. But one thing I've noticed is when we talk about the changes that they're going through and we kind of break down that wall and we talk to them as humans where they are at this stage of life, they're really receptive to the information that I'm sharing with them. So if I tell them that, say, they love to hear their dopamine is higher at this level than any level of their life, and that's why they might be more susceptible to addiction because their mind is changing and they're able to do great things and make cognitive improvements at an accelerated rate. If I'm telling you, you have the ability to understand these issues instead of just some weird old Gen Xer wagging their finger at you and saying, sounding like Mackie from South Park, drugs are bad, okay? It doesn't, it's a lot more effective when you talk to people like the young, intelligent, developing humans that they are.
Or like Nancy Reagan when she said, just say no.
Exactly. And then what? I mean, one tool that we tell our middle schoolers, because in a few years they're going to be driving, is that if they have a friend who's had way too many drinks and might have alcohol poisoning, and they have a drink or two, do they just leave their friend there? No, you call the 911 Lifeline because the police imperative to tell everybody that the community is on their side and we're there to help is so empowering. So they're not going to, because when I say true or false, the 911 helpline will make it impossible for you to get in trouble, even if you've had a drink and you're trying to save your friends. The kids are first amazed when they hear that that's false. Does this give me license to drink underage? Am I not going to get in trouble? Like all the stuff like an immature, or I don't want to say immature, but a person at that level of development is going to think at first when you tell them this is a great tool that saves lives and we're trusting you with it, they are receptive to this information and they believe that you are giving them intellectual autonomy and helping them make wise, rational decisions from their lives.
So a lot of times you're getting ahead of the problem by educating the youth on substance abuse. Am I capturing that
100%.
correct? Okay.
100%.
So let's say in a situation where you can't get ahead of a certain situation, how do you like how do you determine if these kids or a kid is just doped out? Like,
Oh yeah.
how do you, I guess, how do you deal with that situation if it does come
Because
to
of
that?
how I so that is not a that is not directly attached to the field that I personally work in, but it's a fascinating question. And because I've lost friends to substance abuse, and I know some of the signs to look for. This hasn't happened with drug misuse, for example, but I did have, and in our young in our youngest program, Footprints, I had a kid talk about, we were talking about getting in trouble with your family and whether or not you can trust your trusted adult, or you can tell your trusted adult anything, be it for making good choices or preventing a friend from getting bullied, what have you. A kid talked about walking away from home without telling his dad. And he said, my dad was going to hit me so hard I thought he was going to kill me. Now, on the surface, that doesn't, you don't know if is a 7-year-old kid hyperbolic or not. It doesn't matter. I'm a mandated reporter, so I have to talk to the counselor about that. The counselor knew the family, knew the kid. I don't know what happened. I don't want to know what happened, but the point is, I didn't just leave it alone. So if you see a sign, or if a kid is open to you, that's the best thing that can happen, because that usually means that they're looking for support, be it emotional or institutional. And when they give you that trust, you might just have to give the kid a number to a crisis line, or call the New Jersey helpline, which I would like to pass on the number to right now as a mandated reporter.
Sure. And I could put that number in the
Yeah.
description in the link when this video is out as well. So far, I'm really enjoying my conversation with Julian. And if you're still with us, I hope you're learning something new as well. It really makes me realize the gravity and the seriousness of the work that Julian does. And I just hope as a society we could appreciate this kind of work and just social work in general. And like I said to Julian, all the relevant information will be in the description below, so feel free to check them out there. I believe the number Julian there was trying to give was the 741-741, which is a number you could text. It's the crisis hotline. Back to the podcast. What do you think about legalizing certain drugs? If any, what drugs do you believe should be legalized?
Oh,
And as an educator, how does that affect your job? Does that make your job now harder because these drugs are legalized, and
that
so
is,
these
yeah, I love that question, on a lot of different levels, because everybody has to wear different masks. But I think one of my strengths as an educator is I'm very forthright with where I'm coming from and what I believe. And usually kids pick up on that even better than adults. So I 100% believe in the complete decriminalization, if not legalization, of all drugs. End of story, period. I wouldn't go into a classroom and tell a group of middle schoolers that. But if they say, well, I think that marijuana needs to be illegal, and if it's illegal, that would fix our problems. I've actually said to a class, but that's not the reality that we live in. And if we understand what some of the reasons are that the state gave for legalizing marijuana, in terms of even getting more money from taxes into the school system, I just my hope is that I can have, more important than what I think, is how the kids start to think about these issues and how they evolve in the future, because this is their baby that I'm handing to them. I'm saying, think about these issues, think about what you feel, think about why you think it should be legal or illegal. I'm not going to say you're right. I'm not going to say you're wrong. I'm not going to tell you every reason that I've studied criminal justice and drug control and drug laws in the country, and why I've come to what I believe is a very sensible conclusion to legalize all drugs. But I will say that just like marijuana is legalized now, we did not solve alcoholism by enacting prohibition. And prohibition enacted at that time was really, I mean, one of the reasons it was enacted was because the country had historical levels of alcoholism at that time. So you look at the temperance movement, and it was really a failed policy of die-hard individuals who were having their families torn apart by poor economic issues and alcohol misuse, and had every right and reason to advocate for making alcohol legal. So to use that as a metaphor for today, where we might see a situation where cannabis is more out in the open now that it's legal. I don't believe the conspiracy that if you make things legal, then people will want it less, and blah blah blah. That's never been borne out in reality. But what I do see is that if a substance is controlled, and if it is and if the laws reflect the level of control society needs to put on it, it usually is not going to be as harmful than this kind of Delta 8 garbage that you can still get to this day in smoke shops in New Jersey, which is completely illegal in California now. So depending on, so has it made my job harder? Not at all. In fact, one of the things I tell the kids about marijuana laws and legalization is, just because it's legal in dispensaries for residents of New Jersey over 21 to purchase, you can still get in trouble if you transfer it across state lines. There are still different laws in different states. Did you know that in Alabama, if you get caught smoking marijuana with intent to distribute, 2 times you can get convicted of a felony? Just because you don't know the law, it's never an excuse for breaking it. That's a line I always use for the kids. And it's true, because when it comes down to it, the reality of the situation is, and the country, in New Jersey and the country, is we are going to move towards, because it works, frankly, a society where marijuana will be federally legal pretty soon. So there's no reason, I really don't believe that pushing the gates back to make things more, to make it a criminal justice issue or the issue for the police, is going to lead to less misuse. I mean, we can just see there's all sorts of rationales for changes in the level of drug use. Because let's say we're looking at alcohol. In '96, when I was a senior in high school, I think, if I'm not mistaken, 54% of high school seniors reported having a drink in the last month. That number is down to 28% now. So, I mean, if you the amount of success that has happened, the average smoking rates, of course, vaping has gone way up, but you can't explain the reduction of only 11% of Americans smoking daily. That's almost like a statistically insignificant number of people who still smoke. Smoking has pretty much been done away with. If we look at I believe even cocaine use, because it's harder to get and it's harder to distribute in a lot of ways, and it's gone out of favor, but also it's gone way, way down. So drug use fluctuates, and a lot of it has to do with trade, how it's how it's distributed, how it's smuggled into the country. So again, I think the issues for the DEA and the narcos are not the same issues for the prevention educator. My goal is to cut off the demand, help kids make smart choices so drug use continues to uh, be reduced in the future. And right now, I can't think of a better way to try to put an end to this scourge of fentanyl abuse that we've been dealing with in our society, because there's almost no hope around that. You have people dying the first time they use it, and you have basically God, heartbreaking. Just in the community today, someone told me about a spouse who was a heroin addict who used to overdose several days a week, and he was just being kept alive by Narcan. So things ebb and flow is the point I'm trying to get at. And I think that if you at the very least decriminalize things, it gives a tool for the police and social workers and prevention educators to try to go in there and at the very least save lives.
Now, you heard Julian say that he believes all drugs should be decriminalized. So I took the chance to ask him a follow-up question on why he believes all drugs should be decriminalized, because I personally don't believe all drugs should be decriminalized, and I used Oregon State as an example because Oregon was one of the first states that decriminalized all drugs, and it was a massive failure within the state, and I believe that those policies still are affecting Oregon in a negative way. So let's take a listen to what he had to say.
So honestly, I can talk about all the infrastructure problems that went wrong, the lack of a social safety net, the tent cities, the lack of access really to testing kits. A lot of things went wrong in Oregon. But again, for me to try to sell that argument does sound a little bit like no true Scotsman. So what I would say to that is it shouldn't, these are lives we're talking about. We need to find a better way than what we're dealing with across the country, because you can't tell me that states like Tennessee or Ohio, which have some of the most reactionary drug laws in the world, are doing any better than Oregon is with their safe injection sites. And I don't believe that Oregon at the time really had enough community support and involvement to put the infrastructure on the ground that they needed. Now, also, a lot of it could be culturally unique to the social safety net in general, and what Americans at the bottom rung of the social strata or ladder have to endure on the whole anyway. And I think oftentimes there are so many underlying health issues with someone who's under the influence of heavy illicit drugs that can be tainted with all sorts of other horrible garbage as well, that you can't really, you can't just say that it's only the substance. There's a doctor, I hate to bring him up because he has his own demons and misgivings, and I don't agree with all of his opinions, but one study that Dr. Carl Hart did that I thought was very invaluable was the study with rats where he kind of adapted the cocaine in the water. The rat keeps drinking water until it dies. So then the lesson is cocaine kills you, end of story. Okay, that's a nice little package. But then what he discovered is when you start to introduce like hamster wheels and cheese and games and activities and mazes for the rats to do, the level of addiction is reduced in the rats with more social stimulation. I think oftentimes the one of the byproducts. And I am not like a anti-capitalist Antifa warrior by any stretch of the imagination, but I do see what it means to be a part of the underclass, where your community might be in a food desert, might be riddled with drugs, without the stimulation to be able to function day to day. And if you're already in the throngs of an addiction, if you have no other stimulation other than the chemical dependency that you're dealing with, you have no chance, just like the rats. So I think that that study was so invaluable because it shows that the more people that are in the community to help, the more social workers you have, the more police you have who don't just come in as first responders trying to solve the problem by arresting drug addicts, but actually taking drug addicts to safe injection sites and making sure that people get the help that they need. Substance abuse misusers, I should say. If you could censor out any part where I say drug addict, that term has gone out of favor. But it just, people need belonging. People need a sense of community. People need to know that that they can make bad choices and not rebound. If you take all that away and all you have is hopelessness and the high that gets you past that hopelessness, it's just a recipe for a cycle that goes spiraling downward, and there's really no hope. So what I would say is that if you put in the infrastructure in the first place and did a longitudinal study, make sure there's evidence that this approach to reducing deaths among the chemically dependent community is going to help society as a whole. If you can get the police on your side, you can get right-wing reactionaries on your side as well. That was another thing. We had a conference last spring, the NJPN conference, and one of the most powerful speakers that I had the opportunity to watch was somebody who created one of the first safe injection sites in New York. And he talked about how in the very beginning, when he set up shop, people in the community were pushing the police to go after him. Now, the police are his number one advocates, and they're the ones taking people to the safe injection sites to get the substance users away from the general public, to get the help they need. Once they get that help, they might be referred to an emergency room or treatment center if that's what they want, if that's what they need. I also think that what they do in Norway, it would be a much better approach than what happened in Oregon, because you have the government doing longitudinal studies with substance abusers over a long period of time, and then they have and they can continue to use in wet houses, and people are like, oh, why would you have the government pay people to do drugs? Isn't that just the government killing people? No, it's the government just supplying people with a safe need until they make the decision to get better themselves, and using that data to prevent future people from succumbing to the same fate. So that's what I would say about Oregon. I know it's a long-winded answer, and again, I don't want to get bogged down to no true Scotsman, because I'm not just saying, well, if only Oregon did this or that. I think the way that I think it was Katie Brown was governor at the time rolled it out, it was just not really well thought out. But it needs to happen again, and it needs to happen and be means tested, so we can see the data, we can see what works, we can see what doesn't. If there was a program that said, well,
This is where I had to interject, and sorry for the cutoff, because my video Zoom recording had timed out. But here we go, back to the video. I do want to start wrapping up, but before I do that, I just want to read some statistics to you, and I'm sure you know these statistics, and then I want to ask you a follow-up question, okay?
Mhm.
Okay. And these statistics These are three statistics about drug addiction and abuse in America. Number one, overdose epidemic. In 2022, the US saw over 107,000 drug overdose deaths. This was an increase from previous years. This equates to nearly 294 people dying every day from drug overdose. Number two statistic, the economic impact. Substance use costs the US taxpayers over $740 billion each year. This massive figure includes expenses related to healthcare, loss productivity, law enforcement, and criminal justice. Number three statistic. Youth, and this is more related to you. This is or to your field, I should say. Youth substance abuse. Nearly 1 in every 10 adolescent age 12 through 17 reported illicit drug use. My question to you is, what's the solution?
Yeah. Yeah. Okay. So again, the solution I'll keep coming back to is cutting off the demand. It's cutting education, getting into the classroom and telling students the truth about drugs from a young age before they, I mean, I'll just take, for example, stats around alcoholism, because I am an alcoholic and I've suffered, and I've only recovered in the last 3 years. So you look at people who start drinking at a young age, but I think below the age of 14, 42% of those people end up becoming alcoholics later in life. So I would say start educating early and often. And honestly, you hear all this rhetoric about people coming across the border or with fentanyl, or people bringing fentanyl into the country. And then a lot of it is scapegoating and misinformation too. Imagine if the drugs that came here had no buyers. Imagine if you could cut off the head of that snake right there. We wouldn't be talking about all the bad people that that give us our problems, and we just have to get rid of those bad people. Instead, we would be looking at how can we help people make wiser choices? How can we stop food deserts from existing? How can we create a more egalitarian society with better access to treatment? That is the answer. And that answer isn't from me. That answer has been statistically proven. And I will send you some information that backs that up, because honestly, I believe in the imperative that someone who might have a horrible response or experience with a family member or loved one being taken away from them too early, and might want to get revenge at whoever supplied them the drugs. And I wouldn't say you're looking at this the wrong way or you're being stupid. No, what I would say is let's see what works, because we share the same imperative of wanting to save lives.
I have the solution, and I'll tell you guys what I think it is. But I think it only works for kids ages 12, 13, or 14 and under. Are you ready for it? And I'm sure all the millennials watching, or any millennials watching, maybe they'll be able to relate to this. Scare them straight. Scare the hell out of these kids. And I say that because I remember being in 5th, 6th grade and being taught about drugs and drug abuse and drug addiction, and also having these sex ed classes where, you know, they would have someone come in and talk to you, and typically it would always be like some scary looking person. I remember the person that had come speak to us was like this big, jacked up, tatted up black guy, and he would rip a textbook, those yellow pages textbooks, just rip them, and then there he would give his goggles and say, well, take these goggles and these dizzy goggles and say, walk in a straight line. And obviously you couldn't walk in a straight line in those, and say, well, this is what it would be if you were drunk, you alcoholic. And they would say, well, if you ever looked at a girl and you'll get her pregnant and get AIDS. Look, I'm being facetious. I think that does work to some degree, but I believe more in a hybrid model. I I think something like what Julian does, where he goes into schools and speaks to kids on more of a personal level, and the other tactic I was talking about, I think that's a good model. But maybe it was wrong for me to ask Julian of what a solution is, because maybe there really is no solution, and maybe it's more of a deterrence. Because as humans, we're imperfect. But scare these kids straight. I do believe that. Julian, where could people find you or your work?
PIPNJ .org, Partners in Prevention New Jersey, and NJ4S, New Jersey Statewide Student Support Services.
And before we wrap up, what's one advice you have for the listeners? It could be about any. It could be about anything.
Oh, wow.
And I say listeners, like there's a lot of people watching. The only people that are watching this podcast are my uncle and aunt in Maryland. So shout out to my uncle and aunt in Maryland. I love you guys. Thank you for watching.
Thank you. I I would say that every problem has a solution, and we have to strive to make our communities better and be the change that we want to see in the world.
That's great advice, Julian. With that being said, we'll wrap it up.